Part A. Extract 1. Questions 1 to 12. You hear an orthopedic surgeon talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Carlos Mayer, an orthopedic surgeon. How can I help you today?
Hi, doctor. Thanks for seeing me. I've been having some issues with my right knee. Well, not just my knee. Actually, it seems to be affecting more than that now. It started with a dull ache in my right knee. It's hard to explain. It's almost like my whole leg is stiff sometimes, especially when I try to walk after sitting down for a while.
I see. When did you first notice these symptoms?
Oh, it's been a few months. I think it was, yes, I'd say around February. It wasn't too bad at first. Just a bit of discomfort, nothing major. But it got worse. You know, I thought it was just overuse because I walk a lot at work. I'm always on my feet. So I ignored it for a while. But lately, it's been unbearable, especially in the mornings.
So, just to clarify, is it mainly your both knees or just the mentioned?
Mostly the mentioned, but sometimes the pain radiates down my shin, and lately, my hip has started to feel off. I don't know if it's related, but the stiffness is much worse thereafter any long period of inactivity.
All right. Could you describe the type of pain you're experiencing? Is it sharp, throbbing, or more of an ache?
Well, it changes. Like, if I sit for too long, it's like this dull, throbbing feeling like a toothache, but in my leg. But when I try to move, especially going up the stairs, it feels like a sharp, stabbing pain. Sometimes I feel like my leg's going to give out. And, oh, it clicks too. My knee, I mean. It makes this clicking noise every time I bend it.
That sounds uncomfortable. Does it swell up as well?
Oh, yes. It does swell, especially after a long day at work. By the evening, my knee looks puffy and it feels warm to the touch. Sometimes I notice it gets red, and I don't know if it's connected, but I also get this kind of tingling sensation in my foot occasionally.
And what about your range of motion? Can you fully extend or bend the knee without discomfort?
No, not really. Bending is the hardest part, especially squatting down. Extending it isn't as painful, but I can't keep it straight for long without feeling like something's pulling on the back of my knee. It's almost like there's a tight band pulling from behind.
That does sound debilitating. Have you tried any treatments or remedies so far?
Yes, I have tried all the basic ones, and I went to a physiotherapist who gave me exercises to strengthen my quads, but I feel like it just made the pain worse.
It sounds like you've already tried quite a few things. Based on what you've described, it seems like you could be dealing with hansenal-femoral pain syndrome.
What syndrome? Is that common?
Yes, it is quite common, especially in people who are on their feet a lot. It's essentially pain arising from the kneecap area due to improper alignment or overuse.
I see. And if it's arthritis, what can we do about it?
We'll start with nonsteroidal anti-inflammatory drugs to manage the pain and swelling. I also suggest corticosteroid injections directly into the knee if the pain is severe. Physiotherapy will be important, but we'll need to modify your current exercises to avoid aggravating the knee further.
All right, thank you so much.
Extract 2. Questions 13 to 24. You hear a GP talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please have a seat. How can I help you today?
Good morning, doctor. I've been really concerned about my son, Aaron. Well, for the last couple of weeks, he's been experiencing some troubling symptoms lately. He's been complaining of feeling dizzy and lightheaded quite often. He's also mentioned having headaches almost daily. I'm really starting to worry because he says it's affecting him at school. He's struggling to focus and keeps getting frustrated. And a few times I've noticed him looking pale.
That does sound concerning. Has he mentioned anything else about how he's feeling or how it's affecting him?
Yes, actually. He seems quite fatigued most of the time. He's usually a very active child, but lately, he hasn't had much energy for sports or even playing with his friends. He's also been complaining that his vision gets blurry sometimes when he stands up, which scares him. He's become a bit withdrawn because he doesn't want to feel like this around others.
I understand. It's hard to see your child go through something like this. Let's go over what you've tried so far.
Yes, I've tried giving him some over-the-counter pain relief like naproxen sodium for the headaches, but it doesn't seem to help much. I've also tried increasing his water intake, thinking it might be dehydration, but that hasn't made a difference either. We've even made changes to his diet, adding more fruits and vegetables, but the symptoms persist.
It sounds like you've tried quite a few things, but the symptoms are still ongoing. Now, has he had any other health issues in the past that might be relevant?
Well, he's had asthma since he was about 5, but it's been well controlled with his inhalers, and he hasn't had any major flare-ups recently. He's also been prone to seasonal allergies, but nothing beyond the usual sneezing and itching. This dizziness and fatigue is new, though. We haven't seen anything like this before.
Thank you for providing that background. Based on what you've described, Aaron's symptoms could be indicative of anemia. But to be certain, we'll need to conduct some tests.
Oh, is it treatable?
Yes, it is usually treatable, especially if we catch it early. What I'd like to do is order a full blood count to check Aaron's hemoglobin levels and iron stores. As I said, this is a preliminary diagnosis. We'll also check for other deficiencies, which can sometimes contribute to similar symptoms.
Okay, that sounds like a good plan. How soon can we do these tests?
We can arrange the blood tests for later today or tomorrow, depending on what's convenient for you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor called Mihira talking to a nurse. Now read the question.
Nurse Hansen, I think it would be beneficial to conduct an orientation program for new nurses joining our team. This will help them familiarize themselves with our policies, procedures, and expectations.
That's a great idea, Dr. Mihira. What topics should we cover in the program?
We can discuss our hospital's mission and values, patient safety protocols, and communication guidelines. We can also provide information on the electronic health record system and other essential tools.
How can we ensure that the program is engaging and informative?
We can use a mix of lectures, group discussions, and hands-on activities. We can also invite experienced nurses to share their experiences and provide mentorship.
Should we make the program mandatory for all new nurses, Dr. Mihira?
Yes, the orientation program should be mandatory for all new hires. It's essential that they have a solid foundation in our policies and procedures before they start caring for patients.
Now look at question 26. You hear an occupational therapist called Mihira talking to a GP. Now read the question.
Dr. Hansen, I'm following up on Mr. Clark's progress after his recent accident. He's making steady progress in physical therapy, but I'm concerned about his home environment.
What specific concerns do you have, Mihira?
His home is not accessible for someone with mobility limitations. There are stairs, narrow hallways, and a lack of grab bars in the bathroom. These barriers can hinder his recovery and increase the risk of falls.
That's a valid concern. We need to ensure Mr. Clark's home environment is safe and conducive to his rehabilitation.
I recommend a home assessment to identify any modifications that need to be made. We can explore options such as installing ramps, grab bars, and widening doorways.
That's a good idea, Mihira. We can also consider assistive devices, such as a wheelchair or walker, to help Mr. Clark with mobility.
It's important to create a safe and supportive home environment for Mr. Clark to facilitate his recovery and prevent further injuries.
Now look at question 27. You hear an administrator called Mihira talking to a group of doctors. Now read the question.
Colleagues, I'm excited to announce the implementation of a new patient feedback form. This initiative aims to gather valuable insights into our patients' experiences and identify areas for improvement.
That's a great idea, Mihira. How will the feedback be collected?
We'll distribute the forms to patients after their appointments. The forms will be anonymous and confidential, ensuring that patients can provide honest feedback without fear of judgment.
What kind of questions will be included on the form?
The form will cover various aspects of the patient's experience, including the waiting time, communication with staff, and overall satisfaction with their care. We'll also ask for suggestions and feedback on how we can improve our services.
How often will the feedback be collected and analyzed?
We'll collect feedback on a regular basis and analyze the results to identify trends and areas for improvement. The data will be shared with the relevant departments so that necessary changes can be implemented.
Will the feedback be used to evaluate the performance of individual staff members?
The feedback will be used to assess the overall quality of care provided by our team Mihira. We'll identify areas for improvement and provide targeted training and support to staff members.
Now look at question 28. You hear a nurse called Mihira talking to a patient. Now read the question.
Mr. Clark, I'm concerned about your recent missed medications. Adhering to your medication regimen is crucial for managing your condition.
I know, Mihira, but I sometimes forget to take my pills.
Skipping medications can have serious consequences. It can lead to uncontrolled symptoms, worsening of your condition, and even hospitalization.
Skipping medications can have serious consequences. It can lead to uncontrolled symptoms, worsening of your condition, and even hospitalization.
That's important. Consider using medication reminders or setting alarms on your phone to help you stay on track. You can also ask a family member or friend to help you manage your medications.
I'll try those strategies. Are there any other risks associated with skipping medications?
Yes, certain medications require consistent use to be effective. Skipping doses can lead to treatment failure and the development of resistance to the medication.
I understand, Mihira. I'll do my best to follow my medication schedule.
Now look at question 29. You hear a dentist called Mihira talking to the patient. Now read the question.
Mr. Clark, before we proceed with the dental procedure, it's important to ensure that you're in good general health. We'll need to consult with your general practitioner, GP, to obtain a medical clearance.
That makes sense, Mihira. I haven't seen my GP recently.
I'll provide you with a referral letter to your GP. Please schedule an appointment to discuss your upcoming dental procedure.
What information will my GP need?
Your GP will need to review your medical history, including any underlying health conditions or medications you're taking. They may also need to conduct a physical examination and order some blood tests.
Will this delay the dental procedure, Mihira?
It's important to obtain medical clearance before proceeding with the procedure. We want to ensure that you're in optimal health to minimize any risks and complications.
I understand. I'll schedule an appointment with my GP as soon as possible.
Now look at question 30. You hear a physiotherapist called Mihira talking to a nurse. Now read the question.
Nurse Hansen, I'm concerned about the high number of missed follow-up appointments for our physiotherapy patients. This can hinder their recovery and lead to complications.
That's a valid concern, Mihira. We need to improve our follow-up procedures to ensure patients attend their scheduled appointments.
One option is to send automated reminders to patients before their appointments. We can also consider offering flexible appointment times to accommodate their schedules.
That's a good idea. We could also follow up with patients by phone or email to remind them of their appointments.
It's also important to address any barriers that might be preventing patients from attending their appointments. Are there any transportation or financial issues that may be affecting their ability to come in?
We should assess each patient's individual needs and provide support if necessary, Mihira. We can explore options such as transportation assistance or payment plans.
By implementing these strategies, we can improve follow-up rates and ensure that our patients receive the necessary care for their rehabilitation.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a neurologist, Mihira, and an interviewer. Dr. Mihira, thank you so much for joining us today. Your recent work on neuroplasticity and brain rewiring has sparked a lot of interest. To start, could you tell us how this study began? What initially led you to explore this topic?
Thank you for having me. Our study on brain rewiring emerged from a broader inquiry into neuroplasticity, which has been a growing field for decades. However, this particular study was born out of an unexpected observation in our clinical practice. We had a group of stroke patients showing recovery beyond what conventional therapies predicted, suggesting that their brains were somehow compensating in ways we hadn't fully understood. Intrigued by this, we started looking at how specific neural pathways were being reactivated or even reorganized, leading us down the path of investigating how targeted stimulation could lead to enhanced plasticity. This wasn't just an isolated phenomenon, but part of a larger mechanism in the brain's adaptability that we had to unravel.
That's fascinating. So, Dr. Mihira, after delving into this process of brain reorganization, what did your study find?
The findings were quite remarkable. We discovered that the brain, under certain conditions, can form entirely new neural pathways, essentially rewiring itself in response to targeted external stimuli. What was particularly surprising was the speed and efficiency with which this occurred. In cases where we used specific therapeutic techniques, such as transcranial magnetic stimulation, TMS, in conjunction with cognitive tasks, we saw improvements in areas of the brain that were previously thought to be damaged beyond repair. This ability to create new connections in response to deliberate stimulation was something we hadn't fully anticipated, especially given the complexity of the brain's structure.
That sounds groundbreaking. Could you share some insights into what you believe could be the reason for these findings? Dr. Mihira, why do you think the brain is capable of such dramatic rewiring?
That's a question we've been grappling with, and while we don't have all the answers, we suspect that the brain's innate adaptability is far more robust than previously believed. Evolutionarily, it makes sense. The brain has likely evolved to survive in changing environments by maintaining this latent ability to reorganize itself. On a more molecular level, we're beginning to understand that certain neurotransmitters and growth factors, like brain-derived neurotrophic factor, BDNF, play a pivotal role in this process. It's almost as though the brain holds a reserve of untapped potential, which can be activated under the right circumstances. This isn't just limited to post-injury recovery, either. We're seeing similar processes at work in healthy individuals who undergo cognitive training or learn new skills, indicating that the capacity for rewiring is a fundamental part of brain function.
It seems like this could be a game-changer in neurology. What aspect of this discovery do you think holds the most potential to revolutionize treatment, Dr. Mihira?
I would say the most transformative aspect is the realization that we can intervene in this process in a targeted way. The game changer here is not just the brain's ability to rewire, but the fact that we can potentially guide that rewiring through tailored interventions. Whether it's using electrical stimulation, immersive virtual environments, or specific mental exercises, we now have a roadmap for enhancing neural plasticity. This opens up new possibilities for treating a wide range of neurological conditions, from traumatic brain injuries to neurodegenerative diseases like Alzheimer's. What we previously viewed as fixed limitations in brain function are now being reconsidered as flexible constraints that we can manipulate.
That's incredible, Dr. Mihira. Given the potential here, how do you envision this concept being developed further? What would the next steps look like?
Development will likely proceed on multiple fronts. First, there's a need to refine the techniques that we use to stimulate the brain. Transcranial magnetic stimulation, for example, is effective, but we need to understand more about how to tailor it to individual patients. There's also a lot of promise in using artificial intelligence and machine learning to analyze brain activity and predict which areas need stimulation or which neural circuits are most likely to benefit from rewiring. Another key area of development is in creating personalized rehabilitation programs. The brain is unique for each individual, so a one-size-fits-all approach won't work. Customizing therapies to fit the specific neural architecture of each patient is essential, and that's where emerging technology could play a crucial role.
It sounds like there are immense possibilities, Dr. Mihira. Looking to the future, what role do you think brain rewiring will play in neurological care in the coming years?
I believe it will fundamentally reshape how we approach neurological care. The implications extend beyond treating injury and disease. It could revolutionize preventative care as well. Imagine being able to train the brain to resist cognitive decline or even enhance its functionality before any symptoms arise. With advances in neuroimaging, wearable technology, and neurostimulation, we might be able to offer routine brain optimization, just as we now emphasize physical fitness. For neurological diseases, this could mean earlier intervention, slowing down the progression of conditions like Parkinson's or dementia before they become debilitating. Overall, I see brain rewiring becoming central to both rehabilitation and proactive brain health management, transforming the landscape of neurology as we know it.
Now look at Extract 2. Questions 37 to 42. You hear a nurse, Roman Klaus, on the 1-to-5 nurse-to-patient ratio initiative at Mihira Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. My name is Roman Klaus, and I have the privilege of speaking to you today about a groundbreaking initiative here at Mihira Healthcare Institute. We are introducing a 1-to-5 nurse-to-patient ratio policy, a move designed to enhance the quality of care we provide while simultaneously supporting the well-being of our healthcare workforce. This initiative is crucial, not just for the patients, but also for the professionals who work tirelessly day and night to make sure those patients receive the best possible care. Let's explore how this ratio will impact our institution and what it means for the future of Mihira care. At Mihira Care, we are driven by a commitment to provide optimal patient outcomes while creating a supportive and balanced work environment for our staff. The 1-to-5 nurse-to-patient ratio means that for every 5 patients, there will be 1 nurse assigned. While this might seem like a numerical decision, it's much more than that. It's a quality-driven initiative that ensures each patient receives the care and attention they need without overwhelming our nursing staff. The rationale behind this is simple. When nurses are spread too thin, the quality of care decreases, errors become more frequent, and the emotional and physical toll on nurses intensifies. Research shows that when the nurse-to-patient ratio is well-balanced, there's a noticeable improvement in patient safety, recovery times, and overall satisfaction. More importantly, nurses report better job satisfaction and lower burnout rates, a critical factor as Mihira care continues to grow. Now, let's consider how this initiative affects healthcare workers. The obvious answer is that it will alleviate the pressure many of our nurses feel on a daily basis. However, the implications go deeper. With the 1-to-5 ratio, nurses can finally focus more on the patient experience, including personalized care, patient education, and developing stronger patient-nurse relationships. For healthcare workers, this means more than just a reduction in workload. It is about rediscovering the joy and meaning in their profession. Nurses who work in more balanced environments report higher levels of engagement and emotional resilience. Moreover, consistent attention to patients will reduce the emotional strain associated with preventable mistakes or overlooking small yet critical details. By easing this burden, Mihira care will foster a work environment where nurses can thrive, thereby creating a ripple effect throughout the healthcare team, from doctors to administrative staff. The introduction of a 1:5 nurse-to-patient ratio addresses multiple, long-standing challenges within healthcare systems like Mihira care. First, it tackles the issue of burnout, a significant problem in nursing, which leads to high turnover rates. High workloads often result in nurses leaving the profession or moving to less demanding roles. By adopting a 1:5 ratio, Mihira care aims to reduce the workload, thereby reducing burnout, increasing job retention, and improving job satisfaction. Furthermore, it mitigates the risk of medical errors. When nurses are responsible for too many patients, errors such as incorrect medication administration or delayed responses to patient needs can occur. By maintaining a 1:5 ratio, Mihira care ensures that nurses are able to be more attentive to their patients' needs and conditions, ultimately improving the quality of care. It also directly enhances the patient experience. Patients who receive more attention feel more secure and cared for, leading to faster recovery times and fewer readmissions. This initiative will thus improve not only patient satisfaction, but also long-term health outcomes for our community. Looking forward, the 1:5 nurse-to-patient ratio at Mihira care is just the beginning of a larger shift toward more holistic and patient-centered care models. With the right staffing levels, we have the opportunity to integrate more specialized roles within the nursing framework, such as nurse educators or patient advocates, who could work alongside the core nursing team to further enhance the patient experience. Moreover, the lessons learned from this initiative can be applied to other areas of Mihira care. For instance, this ratio might inspire reevaluation of physician caseloads, the role of allied health professionals, and how administrative tasks are distributed. We may also explore how emerging technologies, such as AI-driven patient monitoring systems, could complement this staffing model to provide even more efficient care. Achieving a successful transition to this 1:5 ratio will require careful planning and collaboration across all levels of Mihira care. First, we must assess our current workforce capacity and develop a strategic recruitment plan to ensure we have the necessary number of nurses to meet the ratio without compromising current operations. Retention will also be key, and we will need to implement support systems for nurses to ensure they remain satisfied with their roles. Another critical step will be the restructuring of workflows. It is not enough to simply hire more nurses. We need to rethink how teams work together, how shifts are scheduled, and how care is delivered. Ensuring that nurses have the time and resources to focus on each patient will require changes in our overall approach to healthcare delivery. The implementation of the 1:5 nurse-to-patient ratio will occur in several stages at Mihira care. First, there will be a pilot program in select units, such as intensive care or emergency departments, where the benefits of this ratio can be most immediately observed. Following a comprehensive review of outcomes, the initiative will be gradually extended to other departments. The second stage will involve feedback loops, where we gather data on patient outcomes, nurse satisfaction, and operational efficiency. These insights will be critical in refining our approach and making adjustments before the full implementation. Finally, in the third stage, the initiative will be fully scaled across Mihira care, transforming the way we deliver care. Regular evaluations will be essential, ensuring the 1:5 ratio continues to provide value to both patients and staff as we adapt to new challenges and changes in the healthcare landscape.
That is the end of your OET listening test. Now check the answers.